presentation.
Yeah.
Thank you. Okay, so a very warm welcome to all the guests over today. So a very warm welcome to all present here and are yet to join. I, Shrestha Datta Roy, your host, would like to welcome you to this webinar, where we would like to talk about developmental disabilities awareness as this month is dedicated to it. Further ado, let's begin with the event. This year, the theme for Developmental Disability Awareness Month is the world of opportunities. When we hear the words like world of opportunities, uh, the emotions that come to me is hope, equality, acceptance, and respect. Today's webinar is a bit different from what we have had or may have witnessed in disabilities. Today's discussion is not to solely focus on disabilities, but to focus on what we could do with disabilities, to focus on opportunities, to focus on development that we could do in the part of inclusion, or what is inclusion and how far have we achieved it. So as we have figured out our interventions, so what would be the interventions, who could avail those interventions, and also if the law that we have in our society, what benefits can we have from those as well. So if I may introduce my panelists, so let's begin with so hello ma'am, and a very warm welcome to you too. She is joining us from Ireland. So I hope like she is I think she's still there with us.
Yes, I am. I'm here.
Hello,
The
ma'am.
sun hasn't. The sun is just rising, as you can see through the window next.
Yes.
It's very early in the morning. Still jet lagged, so I think I will be coherent when I'm speaking today. I'm still in India zone mentally. Yeah. So thank you for having me, and hi everybody. Looking forward to the conversation today. Thank you.
So with ma'am's permission, I would like to have a brief introduction about ma'am to the audience to make them aware about the personalities. So ma'am, with a degree in law and psychology and sociology, her prime focus is in inclusive society. Disabilities are empowered. NCP Awards, TEDx speaker. She is an independent accessibility, diversity, and inclusion consultant. She is a trained and experienced assess author to build space empaneled with the GOI under the Accessible India campaign as an auditor for her NGO, which is eKanch Trust. Government and municipal officials from different parts of Maharashtra after many years of volunteering with NGOs around the country and working with people. Ma'am has founded eKanch Trust in 2009 and works personally on every project from concept to conclusion. She has won several awards for her work. So a warm welcome to Anita Iyer, ma'am.
Thank you. Thank you so
Our
much.
next, thank you, ma'am. So, hello, ma'am. I would request all of our panelists to keep their, yes, thank you, ma'am. So, Dr. Rucha Thorat, ma'am, is an MSc occupational therapist. She is a trained occupational therapist. She has worked in the field of pediatric neurorehabilitation and children with neurodiversity for over 20 years. Rendered services as a consultant occupational therapist in multi-specialty hospital. She is currently working as a therapist for kids owned pediatric therapy. She served as a consultant to special schools with ASD and pediatrics and outside pooling. Trained approach such as neurodevelopmental therapies and sensory processing interventions for children with neurodiversity is her specialty.
Thank you, Shrestha, for having me here. I look forward to help and interact with the other colleagues that are present today. Thank you.
Thank you, ma'am. Next panelist that we have is Dr. Mitali Vaidya. She is a consultant diabetologist at Pinnacle Hospital in Thane. She is certified RTI, which is a therapy for autism consultant center, mom to a youngster with autism, and a part of the core committee of the Rajhans Foundation, a non-profit organization working for individuals with autism spectrum disorder. Thank you, ma'am. Thank you for coming over here.
Thank you so
Being a
much.
part for us.
Thank you so much for having me here and giving me an opportunity to represent the parent group, actually. So thank you so much.
Next panelist is Mrs. Sangeeta Pathak. She is a psychological counselor and coordinator for school counselor at all Symbiosis schools. She has had the enriched experience of working as a school counselor for 8 years. She collaborates and works with parents, teachers, and students and conducts workshops and lectures on emotional and mental well-being in Symbiosis schools. She specializes in remedial teaching and play therapy, also overlooks the work done and sessions conducted at Children Learning and Developmental Center, which is also known as CLDC, which is a holistic therapy center for children between 3 and 13 years of age. Thank you, ma'am. Thank you, Sangeeta.
Thank you so much, Reshta, for that kind introduction. And I'm truly, truly honored to be here among such esteemed panelists. Thank you once again.
Uh, and the last panelist that we have, but not the least one, Miss Sandra Santosh. I'm sorry if I'm mispronouncing the surname. Ma'am is a consultant speech language pathologist. She has acquired her education both in BA and MSc in speech language pathology. She works at Symbiosis Center for Emotional Wellbeing, Children Learning and Developmental Center, and a private practitioner. She has enriched her experience working with children with autism spectrum disorder, apraxia, fluency and articulation disorder, dysphagia, cognitive communication disorder, and aphasia. Thank you,
Thank you
ma'am.
so much, Shrestha. I am also overjoyed at being having this opportunity amongst such amazing panelists and also to talk about the world of opportunities for children with developmental disabilities. Thank you.
Thank you, ma'am. Thank you to all the panelists for coming here after taking their precious time for this webinar. So I thank you from the bottom of my heart. Before moving to the questions, which why we all have gathered over here, what is developmental disabilities, and how we can pull up the theme, which is the world of opportunities, I would like to brief and take a moment about explaining what is Disability Awareness Month to our audience. It is celebrated every March. So the National Association of Council on Developmental Disability, which is National Membership Association for the 56 state councils of the developmental disabilities across United States and its territories and its partner collaborate to lead the Developmental Disability Awareness Month. The annual campaign how people with and without disabilities come together to form strong communities. Opportunities. The focus are on people working together to succeed. So DDAM, which is Developmental Disability Awareness Month, raises awareness of the inclusion and contribution of people and developmental disabilities in all aspects of community life and serves as a time to explore the work that it is still needed to remove the barriers. So we are not claiming that we have removed all barriers, but this month is observed as a significance where we could see what are the barriers that we have still left to uncover. So without any further ado, I would like to ask the question for our session to begin with is, can Developmental Disability Awareness Month be celebrated in a different way than the real way that we have celebrated so far? So what could be your explanation or point of view on it?
Yes. Thank you, Srishta. And once again, a very good morning to all of you. And I would again like to thank and express my sincere gratitude towards our head, Dr. Giricha Mahale ma'am, who is also head Symbiosis Center for Emotional Wellbeing, for giving me this incredible opportunity to be a part of this wonderful webinar hosted by our Teams Q. And I'm again truly honored to be included among such esteemed panelists. So again, grateful for this opportunity. And coming towards the question of this Developmental Disabilities Month and spreading awareness about it, so if we can start is, what are the common developmental disabilities that are seen? Those will be autism spectrum disorder, cerebral palsy, Down syndrome, hearing or vision loss, learning disorders, and even ADHD, that is attention deficit hyperactivity disorder. And if we go to see, all these are lifelong conditions. So individuals having this will have to bear this condition. It's a lifelong condition, as we say. So according to me, what would be the best way to celebrate this month, or how can we even celebrate this Developmental Disabilities Awareness Month? So it would be by celebrating the unique skills, by celebrating the unique talents or unique abilities or potentials the individuals with developmental disabilities have. And of course, breaking the barriers that prevent them from living a meaningful life. Because if we go to see, despite of these challenges and despite of these concerns, like anyone else, like all other individuals, even they have some unique interests or unique strengths. So we as society, we need to focus on that rather than the disability, and rather than discriminating them as, people with developmental disabilities, we need to have an inclusive approach, by celebrating this uniqueness. And then, so how can we do that? Maybe by, understanding or getting more insights about these conditions or their different specific needs, or trying to understand their preferences, so that then we can have this inclusive approach rather than treating them a different part of our society. Now, if you go to see, in this month, there are so many local events that are being organized. So, we can take that opportunity to deepen our understanding. It shouldn't just be a date marked in the calendar or a month marked in the calendar and then it's over until the next year comes. So, try to understand how, we can include them in our society. And there are so many organizations who are working already towards giving them better lives. So maybe trying to visit them, trying to understand their needs and preferences, trying to even volunteer them, sometimes, just by giving our time or some skills that we have. So giving those skills over there as a part of their vocational training. And this way, so by changing our basic mindset, because actually, if you go to see, they have a lot of strengths and a lot of potentials which are there, and they do have opportunities. Opportunities are available. We just need to spread awareness about that. Like, there are so many opportunities available in form of occupational therapy, in form of speech therapy, remedial teaching, or even behavior modification therapies. And so that being the first step towards opportunities available. And then, of course, there are so many organizations which are giving vocational trainings and skill development programs for individuals with these disabilities. So, spreading awareness about them, because there are many now companies who have this affirmative policies where they are into recruitment of, individuals with this difficulties, and they do have a retention policy also to enhance the employability and to integrate them into workforce. So, spreading knowledge and awareness about these organizations who give vocational training in specific areas like computer skills or office administration, cooking, gardening, handicrafts, or even they empower such individuals to start home-based ventures which align with their interests and abilities. So opportunities are there and they are very much a part of our own society. So in a way, we can celebrate this one by celebrating their uniqueness, because if we go to see, we all strive to be unique. We all want to be unique. We all want to be different. And when there are individuals who are unique, we want them to be like everyone else. So we as society expect them to be like all others. The parents or the family members expect them to be like all others, forgetting to celebrate their unique abilities. And they can achieve so much with that. So maybe a change in the mindset could be also one of the steps ahead. This is what I feel. And so I think this webinar also should, as we go ahead, should give us more insights about what are more opportunities available ahead.
Definitely, ma'am. Definitely. We are looking forward to update ourselves, to rewire even our definition about what is unique and what is acceptability and what is the inclusion that we are expecting. So thank you, ma'am. Thank you for that beautiful answer. So moving to the next round, like now that we have known that we have to change our mindset, maybe we need to know that there might be some questions regarding some interventions as well. So my next question goes to Dr. Rucha Thorat, ma'am. So the question would be, how can we redefine traditional notion of success to accommodate individuals with developmental disabilities and provide them with meaningful? So how can we talk about that now?
Yes, thank you so much for that question. And it's rightly coming in stream with Sangeeta ma'am's answer. As she already mentioned that we have to change our mindset and we have to look at the uniqueness of these children. That itself defines my answer. So now success is, I feel, entirely very subjective and is very personalized process, which is often shaped by our values that we possess, our personal experiences. And it is constantly changing as we move through our life's process. It constantly shapes us. We change our viewpoint as the way we take up our roles, different roles in our lifespan. So as you all know, we all probably traditionally are driven by the concept of success being, it is more of a performance-based idea of our social model, that in our society, one is successful when he can perform in XYZ role. It starts from your childhood to adulthood. So from a child, or neurotypically growing child, let's say for that matter, who goes to a school or a preschool area where he's expected to behave in a particular manner or giving adaptive response, or maybe he should be able to hold the pencil in a right manner, not to hit anybody, listen to the teachers, follow instructions, and that forms his success basis. As we move further, we define it by our scholastic and academic performances. As we move further, what job we take up, how successful we are in our career. That's all is what we define our notions. And this is how it is. It is more of a performance-based model of our society. So in this, by viewing this as a success definition, and I don't think there is any easy to fix in a box answer or a fit in a solution to this. But while viewing this, we miss out on a big picture in terms of talking in terms of the children, that we only grade them or we only associate them or examine them in terms of their scholastic performance. or the way they behave. And the big time we forget about their abilities, how they are playing, what are other talents and other skills are. How is their ability to form relationship with other peers group in the context they are living in? How is the family time they're getting it, and what is their playtime definition is? So while understanding all these things, we often tend to apply the same concepts of performance-based model to the children who are behaving differently in this society as well. So we often, when they go to the school or when they go to a form a preschool or a peer group relationship, we often tend to look at that, oh, my child should be able to write, he should be able to read, how well he can write the examination, how. But we, in the ball game, we forget that these children are different. They have, their abilities are different, the way their brain function differs, with the way their brain receives information, perceives information, or experiences the world around them is different. And hence their learning is going to be different. So first of all, this understanding and this acceptance itself is the first step which can unfold the opportunities for them. Unless there is an acceptance, we cannot have an accommodative nature. And that's why we cannot unfold various opportunities to them unless we have this acceptance and understanding from a caregiver perspective, from the parents' perspective, as a society. And we want to talk about the inclusiveness for them into our society. So where should we have the shift in our understanding is itself the word disabled. The word disabled often makes you the impression of is being liable on the society. He's not able to do certain things. So can we shift that understanding for being just telling this person as of his child who is functioning differently, processing differently, he can function if we can provide them with some accommodation, some strategies, some aids. So we have to look at the child, what he can do rather than what he cannot do. So World Developmental Disability encompasses all those children, as you have mentioned rightly, the children on the spectrum, the learning difficulties, the cerebral palsy, those who have congenital anomalies. And as we pick them up early, as we accept them early, that becomes the first step of success for them. The parents accept them early, and we don't look at them as a cure, when providing the opportunity for care and support. We don't want to cure them or fix them. We want to change them. We want to bring in the change of growth in them. That's the mind shift or the notion that we have to start believing in, that these children, that is their unique identity, their brain is unique, that is how they're going to understand the world around them. So help them with therapeutic support which is directed towards more of growth versus just the change. So in contrast to deficit based, what I want to call is focused of fixing the impairments which are associated with their neurodevelopmental condition, let's acknowledge their strengths. Let's acknowledge their interests. Let's acknowledge their context they're living in, and bring in front of the parents that this is what your child can achieve with certain accommodation, with accessibility, with certain strategies in the environment he's going to be in. So that will slowly unfold the opportunities that the child is going to have. Suppose the child is going to go to the preschool tomorrow and the child has a problem with the sound sensitivity, or he has a problem with the staircase. Or can we have the ramp there? I can walk if there is a ramp, or if I've been given a walker or a wheelchair, I can sit on a wheelchair and perform in the same classroom. Sound sensitivity, if somebody can give me earplugs, I need to wear them. So this awareness should bring into the society that, yes, then there is an opportunity is opened up. Yes, this child can go to the school, sit around the 10 different individuals of the same age and learn in the same environment. So the first is to change our notions toward disability, towards ability model, what they can do, and be more open towards it, be more accommodative, and celebrate their little successes that will bring them upfront to the society. That's what I feel.
Thank you, ma'am. Thank you. Absolutely, the individual uniqueness of every one of them should be catered as well, both in law, structure wise. If made provision, it would do wonders. Definitely, ma'am. And say the true definition of inclusion would be absolutely applicable in that sense. Uh, when we talk about like caregivers, so we have a caregiver among us. So as we said, that inclusion, change of thoughts, the society, the parents. So the next question of mine would be to Dr. Mitali Vaidya ma'am. Uh, as a caregiver, what are the roles and responsibilities that one would like to share over here?
So I believe that I mean right from childhood when you have got a diagnosis and then you have started with therapies and all. As a parent, it is important that you do not lose confidence about the parental nurturing instinct. Sometimes we have seen that parents start depending more upon therapists. Therapists definitely are there to guide you, but they are there for a short time. They will guide you how you can generalize whatever they are learning, be it school, be it the different therapies that help the child to, I mean, they will help the parent to understand what they can do with it. But then it has to be generalized. So apart from the other responsibilities of a caregiver, like good nutrition and everything, taking other care of the other things, it is important that you do not stop your parenting anywhere. I mean, the guiding part of the parenting that we really enjoy with any child. So just because your child has certain challenges, you need not lose out on that, because it has, we have seen that happening with some parents. So whatever is being taught, whatever is being done in therapy, I feel that you should start generalizing it in your daily life. It shouldn't be again, a repercussion of, I mean, this repetition of what is being done there, but try and generalize it. If suppose use it to do your allow the child to be a part of your daily chores, something that you do, because that is how they learn. When later you want them to be a part of the opportunities that will come along, it is this particular knowledge which is going to help them to be a part of the society. So again, don't shy away from taking them anywhere. Of course, you might need some uh, supporting things to be done, as I said, with some, if they have a sensitivity to sound, as Rusha ma'am really put some very good points. They might have certain things that you need to help them with, help them out, but definitely take them everywhere you go. Make them a part of everything that you do, so that they learn to be a part of the society, and the society also learns to accept them as a part of themselves. Because there may be a few people who might have some problems, but most of them are very supportive. And if you want them to be for the acceptance to increase, it is important that everybody comes to know about what are the challenges they face, and what are the things that they can do, the potential that they have. So that is one thing which I would like to say. Another would be that do not focus too much on the static skills. Okay, what I mean, the academics, the whether they can pronounce words, or whether they know whether they can make a sentence, that is important. There is no two ways about that. Of course you need to focus on that, but that is not the only thing that you need to focus on. The quality of life depends a lot on whether the speech is important, but more important is communication. If they are able to understand, take our perspective, if they are able to share something which is happening with them, then that is really very important. If they are able to be a part of a joyous occasion that is happening, that is something we really need to focus on. And maybe pace our events, or to accommodate their needs, so that they are a part of it, so that when the inclusion will start from home, and then it is going to go out in the society. So another thing is, sometimes because of this competition that we see outside, sometimes a lot of pressure is put on the children, because if they are not doing it, then we increase the number of hours that we are making them do it, or number of times that we make them do it. So sometimes as an RDI consultant, I feel that we are not really looking at the readiness of the child. What is the readiness? Sometimes we just look at the age, and we are like, no, at this age he needs to do this. and then there's a lot of desperation that sometimes comes into, and when you're just behind this, that it has to happen, my child has to be busy for so many hours in the day, otherwise he becomes hyperactive or something. But sometimes it is too much for them to process. So just static skills and just being busy is not enough, because there are sometimes we have this that just keep them busy. It is not so. It doesn't work like that. So focus on things like, even we have our own ways to unwind ourselves. So is your child able to unwind himself? Have you given proper choices to him to unwind him or her to unwind him? All these things also are important. So again, there are also children or individuals, like as we say. So sometimes we forget, we remember the label, we tend to forget that they are again children. Sometimes it is better if you can have another, maybe a child at home, or maybe another children who are around, maybe nieces or nephews. Sometimes it helps to see that they are going to be resistant, even typical kids are, so those kind of things should be kept in mind. As caregivers have a lot of responsibility, because sometimes they have to focus on the therapy as well as being parents. So I think they should not forget the parenting part, the guiding part, just being with their children, just enjoying life, and show them that that it is not about what you can do. I mean, it's not an exam. Life is not an exam all throughout. Could you say this word? Could you do this thing? It is okay to make mistakes sometimes, and we'll try again. So this kind of trust and ease should build up with the parents and the children over time, so that later when the society is not going to be very considerate, because it's not for us also, it is not. So at that time they should have someone to fall back upon. So that is what a parent or any caregiver should be. And of course they should look out for opportunities for their children, and or create them for them as is possible later.
Thank you so much, ma'am, for that really like hard. It is like I would definitely agree that every one of us would have a definition about how how we can like express something. What is the mode of expression? And I think we have also used that scale to measure development and progress as well. So yes, definitely we need to personalize it and tailor made it to individuals, so that it is never been a scale which is really burden for anyone, but a scale to see progress.
So every step that they make ahead is for them, it is a huge thing. So, and
Yes,
for
yes.
the caregiver too.
That, uh, moving forward, I would like to ask Anita Iyer, ma'am, um, some questions. So, as ma'am is a part of law firm as well, so I would like to know how can we foster greater collaborations between education institutions, employers, and community organization to ensure a smoother transition into adulthood for individuals with developmental disability. So,
Um, I'd like to correct you. I'm not a part of a law firm. I've done my law. It's a
okay,
certificate that I have. Yeah. So yes, I do advocate for inclusion. Um, so I've been listening to everybody speak, and I think all of you brought in very wonderful points. And it's amazing to find that parents are becoming more aware, and not just aware, but they're also participating in the lives of their children with disabilities. It's a huge step forward. It would have been wonderful to have some men on the panel as well, because we want the fathers also to be a part of this whole thing. Because when we say caregivers, therapists, teachers, somehow we only see women. Even when we are sending out invitations, when I conduct these programs, also typically I find that there are 99% it's always women who are there, but men are also capable of and willing to contribute quite a bit. So when I conduct these workshops for sensitization workshops for corporates, I find that the men who are working there are also concerned, but somehow we have stuck this label of provider on them. So they make sure that they can pay for the therapy, they can pay for the outings, they can pay for the education, they can do a lot more than just pay. They want to be a part of it, and somehow we have also been extremely sexist in leaving them out of these conversations. Women are equally to blame. So I think one thing that mothers need to do is to partner with their spouses in bringing up the children. When we talk about companies also, when you're asking about how we can all get together and form policies, like Mithali said, very important to see people with disabilities everywhere. I know that accessibility, which is what I work for with the government of India, the name of my NGO is Ek Ansh. So my how I look at it is that each of us forms a part of this whole society. So each of us has to take responsibility, and everybody has rights. Correct. And the logo itself says awareness, acceptance, sensitization, and then inclusion. So while we all talk about inclusion, you can't begin with inclusion. You have to begin with awareness. Who are you including? How can I be included? Mine is an outside in approach because I feel that society really needs to be sensitized. And that will not happen through lectures and workshops. It will happen only through direct interaction. So, what I have done through my NGO is there are two parks in Pune where we have put up equipment where a wheelchair can get onto a swing, a wheelchair can get onto the roundabout, and it's in public parks. And I really wish that this would happen all across the country. There are some cities that have them, but somehow the park is, labeled as a special park for children with disabilities. So it can't happen at the workspace. You can't expect that a new parent of a child with a disability suddenly understands a disability unless that parent also has interacted at some point of time with someone with a disability as a child. So I really, really push for children with and without disabilities to play together in a neutral, non-judgmental public space. And I find that it happens very easily. It is very easy to influence kids as compared to elders who have these fixed mindsets, fixed schedules. We really don't have the time or the bandwidth. So we are constantly trying to fit things in. Even parents of children with disabilities are fitting the child's needs in. They already have a schedule. And if they have to go away from the schedule, or if the mother has to drop a career or drop an appointment with friends, or maybe an outing with friends, it becomes like something that she's doing extra for the child with a disability. Whereas if we grow up with the feeling that they're all a part of our society and we're all here for each other, like for example today, it's not very rare to find a woman in a restaurant having her lunch or dinner alone on a table separately, right? This was not the case when I was growing up or I was a teenager. I have always been a rebel, so I used to go out and eat on my own when I was working. But most of my friends would say, how do you sit alone in a restaurant and eat? Why? I have to feed myself. Similarly, with people with disabilities, if they're seen everywhere being independent, taking care of themselves, or with the caregiver, or with the need, with services are provided for them, like a ramp is just the first thing. It's a tip of the accessibility iceberg. There's so much more that you have to do when we talk about accessibility. There are people who are visually challenged. There are so many times that ramps are put up in such a way that people who are blind will trip and fall. So when you're providing for one disability, make sure that you're not creating a barrier for other disabilities, right? So very deep understanding of accessibility and inclusion is required. Awareness first. So whether you're a part of the community where you have someone with a disability in your family, or you are a person with a disability, or a part of society, nobody leaves their original personalities at the threshold when they're getting into a workspace. For example, when Sangeeta ma'am must be coming to school, she's bringing with her all the years of her growing up, where she grew up, who her parents were, what she was taught, what she learned, what her attitudes are. All of that comes into the college with her, into the center with her. So that has to be molded first. Just doing a course, I'm sure she has learned so much more from interaction than from the actual course that she did to be a consultant. So for that to happen, all parents, all therapists have to take children out. I have conducted programs where I have taken regular schools and so-called special schools, or schools for children with disabilities, for outings to parks to play together. Leave them alone and let them organically start communicating with each other. Do not interfere. Let them form. Let them understand each other. If you don't see them in parks, I promise you, you will not see them in boardrooms together tomorrow. You will not see them in workspaces tomorrow. You're not going to be holding their hands all through their lives. You're looking at empowering them. Let them play together first. I played with boys growing up in Bombay, so I never saw them as a different species growing up. There was never any fear in communication, right? The moment you start separating them, schools are, you can't have a 100% inclusive school, because you can't possibly have children with all different disabilities and without disabilities in the same class. It's going to be severe pressure not only on the teachers, but also on the children to cope. The very people that we're planning to serve or planning to accommodate will find it difficult to cope with everybody else, because school is a competitive space. You're going there to learn. There will be examinations. You have to score. See, what is an examination? It is not something that is meant to create discrimination. It is just to ensure that you have learned whatever has been taught to you in that particular year and you're ready for the syllabus that will follow next year. It is an important step. So to say get rid of exams, exempt people, that's not the way to empower. Like everybody here has been saying earlier, find these strengths and then strengthen those strengths even more so that they are able to find a proper path in life. That's what we need to do. So basically, my entire approach to inclusion is begin at the beginning, begin with children. Also, we are extremely privileged to be here. All of us are extremely privileged people. We work in slums where parents don't even know that their children have developmental disabilities. They have not been given the developmental milestone list by the doctors when they have delivered the babies. Some of them have delivered babies at home. So what we need to do also is to reach out to our house help perhaps, or people from that particular strata, and make sure that they also understand. So when we had these outings in parks, the security guard and the people there said, we have never seen so many children with disabilities in our park before. They have also not seen it. You want society to understand, they should first be allowed to interact and see. The first few times will be difficult. There will be people that laugh. There will be people that mock. There will be people that do not understand. But like Mithili said, most people, I believe the people are basically kind. So 3-4 times later, once they've seen your child and once they know that the child is going to come again this evening, you will find that they will approach your child and find a way to accommodate and to include. So patience is extremely important, and awareness, of course. Without awareness, we should not be taking any steps at all. And sensitization. Thanks. There's so much I can go on all day, but I should give way to the next speaker now. Thank you.
Ma'am, thank you for that enlightened and wiseful answer for us all. Accordingly, if I may just add a few things, it's just for me. It's like that instead of us and them, it should be we. Let's be like we are going to this entire process. We are going through this entire transition. That until and unless that them or they has been converted into we, uh, I think barrier still remains. But yes, the more the exposure, the more we would be aware, and the more it would be transitioning from acha wo say it would be us, and it
Yeah,
would
we
be
would understand better. And also, when we sort of point fingers at the government officials, municipal officials, the fact remains that they have themselves never interacted with anybody with a disability very closely. So they actually do
yes.
not know why they are. See, you can't just make rules. Why are those rules there? Why do you need the ramp? Why does the ramp have to have a certain gradient? Why do you need tactile paving? Why are you doing these things? Why do I need a counselor? First of all, you have to, the trustees of the school, I'm sure Symbiosis knows, everybody has to be on board about why do we even need a counselor? What is a counselor actually going to deliver? Is there a need? Is there a need for a therapist? So unless you are aware, like I said, awareness first, and it will not happen without personal interaction. We have to begin
Yes.
really at the beginning so that the next generation, my daughter and granddaughter, need not be on a panel explaining why inclusion is necessary. That will happen only if children start playing together and start interacting from the very beginning in non-judgmental spaces, not where you're being assessed for your intelligence or for your physical ability, which is what schools are about. Finally, what is a school about? It is about your intellectual capabilities. So you don't try to fit round pegs in square holes. Try and get them to interact in a space where they're not being judged for any of these things. That'll be wonderful because you're still friends. You have friends outside of school, you have friends outside of college and outside of your office of workspace. Similarly, they have to have those friends that they meet in the park and they're not being judged at all. So non-judgmental spaces must become inclusive first.
When we talk about awareness, therapy interventions can also be like considered as a part of awareness equally as well. So I would like to ask my next question to Dr. Rucha Thorat ma'am. What role do early intervention programs play in maximizing opportunities and outcomes for individuals with developmental disabilities?
Thank you, Shrestha. Now, what is early intervention means to us? It is nothing but the identification or the early detection of the possible red flags or the high risk babies that are presented to us from the hospital setup. And they present to us with certain possible diagnosis or the indication or a probability that this child might have or might go in the future in this kind of categories, which could be any type of developmental delays. But the role or the purpose of early intervention doesn't end just here into just identification of those red flags or high risk babies. And it opens up for the parents and the other caregivers an opportunity to understand what is going on with that baby. Saying baby is having XYZ is very easy, but bringing to the platter to the mother, especially who's the most first bonding for the child is the mother infant bonding, and making her understand and proactively empower her is what is the essence of early intervention. Not only her, of course, the entire family. From the social perspective, is what is important philosophy or mission should be of the early intervention. So, for instance, if I have to give you an example, that if there is a preemie born and it has been assessed, I suppose, at the high risk clinic or the developmental OPDs, and maybe there are certain biomarkers or certain behaviors that may indicate that baby could possibly fall into the risk of developing delayed milestones or sensory processing issues. So what does this statement means to you? What does the statement means for mother or a caregiver or for that newly born parents? Is that they possibly go in a shock. What does it mean? What do I understand by this? My baby is at risk of developing a developmental condition. The next question is for them, is he going to be a normal? That's what their next question is always. What the feelings they go through is mostly the shock. Then there could be a denial, and then could be possibly depression. And it takes a lot of time to come to the acceptance that, oh, this is what I'm going to sell into. But yeah, it is not very easy for parents to take in the idea that something is happening or going something different for my baby. So there has to be a role of education here for the parents from the medical fraternity perspective always, that what you mean that you need to follow up your baby means. What do you mean your baby is having a delay? It is not only the physical delay. We often look at the delay or disability, meaning the physical one. And that is what is brought to the surface because that is what is very apparent and visible. A child is not able to walk is visible. A child is not able to communicate or have a language of speech delay is visible. I mean, that's what parents come to you. Okay, my child is not able to communicate with me. But maybe there's something underlying factors or neuropathology or within his own body system, something is going on which is preventing him from doing so and attain certain function. This is what one needs to highlight as a process of early intervention for the parents. So parents needs to be aware what as nobody looks into the milestones of the baby as a newly born parents. Not even I looked into when I was a parent initially. But you come to know how my baby is responding to you. Is he relating to me? Is he able to form a relationship with me? Is he having that mutual cooperative play with me? Is he going to give me that gleaming, beaming smile as I'm smiling towards my baby? How is my baby getting fed or accepting me as a mother into the system? All those components form the development. It's not only the physical. It has to look into what is the sensory processing for that baby. What is a cognitive component for that baby? How is my baby's emotionally getting affected or impacted by whatever is going on currently with him? It could be, and how early, it's always the question. How early can you begin the early intervention process? As early as you know, as early as the baby is born, probably if you're that lucky, if someone can bring up to you that part. Now let's take care of this baby. Let's be more curious rather than being suspicious about that baby development. Instead of my baby's not doing this, or masking, okay, he's delayed because I was delayed sometime back in my life. Let's not mask that baby's behavior by our perception and our past experiences. Let's be more proactive, more inquisitive, more curious about the baby's development, rather than be just holding back a step. Oh my God, he's not doing so and so. Maybe later, let's wait. Let's listen to what grandparents say. So let's become curious. Oh, you are not able to probably respond to me the way I can. Maybe you need a different ways to handle the baby. Those different ways of handling, nurturing, how to have a communication style with that baby needs to be taught to a caregiver as an early intervention program. And this will make the parent more empowered and more confident towards acceptance of that baby's issues, if at all they are issues. And of course, these early intervention program, as you said, do they play important role in the outcome measures? Of course, they do play a very important role in the outcome measures. And these outcome measures depend on the baby's, what is the brain unique architecture is. I mean, what is the baby's born with? What is how much the extent and significance of the damage that the baby has? What are his strengths? Again, I don't underplay here I don't want to underplay the impairments that are associated with the neurological condition, but yes, they are there as a set of repertoire or whatever the baby has due to neuropathology. But what are the strengths despite of that? What is the context that the baby is going to live in, the family, the environment? What are his own facilitating factors of that baby himself? And what are his own personal barriers? These all will form a sort of a toolbox for the mother to look at. Okay, my baby, yes, he has this strength which I can, build on. Okay, he needs a support here, which I can assist him. This is what the mother or a caregiver needs to understand, or made to be more observant about this, rather than just the label or the diagnosis, because that is something you cannot change. If a child with cerebral palsy is going to be a child with cerebral palsy throughout. So you cannot change the condition, the cerebral palsy or autistic condition, or the features, but you can certainly work with what they need. So once this is an opportunity, I feel that early intervention program brings for the parents, that help them understand their child and just make them the better version of it. That's what we work towards. What is the use if the child is just walking but not able to go from one point to another to bring something for himself? Then that walking is not functional. So we need to help the child how to walk with support and cater to his needs, and that should start very early. Suppose a child is able to walk with the walker, but there's an insistence, no, my child should walk independently. So that sort of brings him one step back. I can walk with walker, let me walk with walker. So I can go out and play with other kids. I may run, I may take part in the sports competitions in the school using a walker or tripod, canes or crutches, whatever is depending upon the condition of that child. But let them use that crutch or a cane or a walker, whatever is required at that point of time. That will unfold the opportunity. Oh, I can do this because you had provided me with this set of support and accommodation. So this is how we'll facilitate and enhance his outcome measure. Otherwise, child will be just home stuck, though he can go out with the help of walker or maybe with the help of supervisor. But if you don't provide them with this type of an opportunity, with help or with aids or with supervision, then you are shutting doors for that particular strength or ability of his which you could have otherwise mastered with the support. Just like we are using all glasses to read a book. And if you take out my glasses, I can't read. You shun away from me that particular experience of reading or seeing you people. So I know it is very simple as I talk, that looks simple, but to accept these accommodations of accessibility in our life is, for the parents, is very difficult, because they go through that process, that why my child and why this, and it is all very natural responses of there. So again, it definitely impacts your outcome measures, the way the child is going to behave or function in his day-to-day life, because when we call this disability, it impacts the life day-to-day functioning for that child and also its successful participation in the society. So once we know that this child has a particular area, is struggling with a particular area or the skills, and we provide them with the supports and the training with the help of right amount of therapy, the child could master that skills and be able to use it efficiently day to day life. Just using the raising the hand up and down 10 times through suppose a particular type of exercises and not being used for feeding is not going to make child independent. So you have to use that movement or use that limb or whatever your therapist has told, the way the exercise is taken into the function. The opportunity should be provided to the child. Let's eat together. Let's have fun together. The hand is there, but hand doesn't know how to use it for eating or self-dressing or feeding or buttoning. Then just doing mere exercises and not bringing it into the real life function is have no meaning to no meaning for the child. So that is why it has to be a meaningful occupation for the child when you do certain things for him. Why do we teach the child to play? Early intervention, when the babies are coming to us first, we just help them to play. I mean, we just teach parents to play. Why do we teach them to play? Because that is what their basic function is. Otherwise, how will they explore the world if they don't touch around, move around? How will they know what is going around them? How will they know that this is my mother? Is through exploration and play. So that is the essence of early intervention, that you help parents understand, give them a meaning why it is to be done, how it is to be done, and provide them with the opportunities to be practiced at home. So they are kind of little stress free, the burden on the parent, that yes, I can. I could do this with my child. My child could accept feed from me. My child could study with me. We and he could read together. So that is how the early intervention play a role in maximizing the function for any particular type of child to be more successful in this society.
Definitely, definitely, no. I think that explains a lot about what we we talk about early intervention and how it could be helpful to each and every individual. And as you well said, that it is to understand the child, it is to understand what my child is communicating, or how to understand their communication. If I want to comprehend, or if I want to understand or crack that puzzle, what my child is going through, then definitely the early intervention is something that can be fruitful. So when we come to communication, I think speech is something which is definitely understood as a common tool to communicate. So the next question of mine would be to Sandra Santosh, ma'am. So, ma'am, speech therapy in the present era of intervention. So, what could be the impact to cater to developmental disabilities? And is there any age restrictions to it, if you may know?
Yeah, sure. So thank you for the question. I think in terms of speech therapy, right? So when we tend to listen or when we tend to talk about speech therapy, we all tend to focus on the speech aspect of it and not about the other aspects of language or communication. And I think, as Dr. Mitali had also mentioned, communication is actually the crux of everything. Speech and language are both a part of it. So if you draw a Venn diagram, right? So there's a circle of communication, that'll be the bigger circle. And then you have language, and then you have speech, right? So communication is the basis of all of it. Because at the end of the day, what we all do is communicate, right? Whether it's through facial expressions, or whether it's through a gesture, or whether it's through a simple smile, or whether it's through speech itself, right? Like right now, I'm using hi or hello. That's a speech. But at the same time, I'm using it to communicate. And the communicative action of that is to greet or to say hello or to, say that I'm here. So whether it's speech, language, or communication, we need to be able to empower children with developmental disabilities, and not just developmental disabilities, but everyone, that the crux of it is communication, right? we should be able to, are they able to say their needs? Are they able to communicate their wants? Are they able to communicate that they don't want something, that they do want something? What do they want to do? What do they not want to do? All of these are very, they're very, how to say, the very basic needs, right? And if you don't have, we're not able to communicate that, are you able to actually function, and are you able to interact with other individuals? Because that's how we all start, right? We all start communicating by saying a hi or hello, or asking another person how they are. Or are you able to read those communicative cues that you have from a conversation with another individual? Like, are they feeling sad or are they feeling happy? Those emotional inflections, are you able to read? Are you able to understand? Are you able to use that when communicating? So all those things are very important in terms of speech language communication, and to empower children with developmental disabilities, and not to just stress them with speech, right? I feel a lot of individuals, a lot of parents, a lot of caregivers, a lot of teachers, a lot of individuals in and around a child's life tend to stress on that factor. There's like, oh, speech has not come out yet. They're not making a sentence, like Mitali ma'am said. They're not making a sentence yet. And they tend to compare them with their peers or the neurotypical peers, where they say that, oh, they're speaking in paragraphs, they're speaking in sentence. But are you actually focusing on the fact if the child is actually, interacting with you? Is he paying attention to you? Is he giving attention to your speech? Is he or she, are they initiating communication? Are they initiating communication? That's a very important factor. Whether, it's not just about you always telling them something, right? It's not just about you just pushing things into the child and just always stimulating them. Are they initiating back to you? Are you making the environment comfortable enough that they do initiate with you? Are you giving them as many opportunities, whether that can be through just speech, it can be through language, it can be through an alternative or augmentative sort of communication, right? um, it can be a technology based app. Are you giving them any sorts of means to communicate? Okay. Certain children, especially with developmental disabilities, whether they fall into the autism spectrum umbrella, or whether they fall into cerebral palsy, or whether they fall into apraxia, or whether they fall into Down syndrome, we tend to focus, I think, which has been the general trend of our conversation today, is that we all tend to focus on their disabilities and not them as an individual. What are they needing in their life? And what are their specific talents, and what is their personality? Some children, how much you try, how much you push them, they just don't want to fall into the typical road of speech. Okay. They might fall into another road. Like, it might be a road less not taken, but that doesn't mean it's not a road nonetheless, right? So just because we all speak, I mean, and as you see, even amongst us, right? Even amongst as the so-called neurotypicals that we see, we all have such different ways of communicating, right? And how we communicate, the words we use, the intonation we use, how we make these paragraphs, how we read certain things in a conversation is very different. So why can't it be different with other people as well? Why can it be different with, children who have developmental disabilities? Why do we see that as a stigma, and not just accept them for having a different means, for them taking a different road? And I think we, instead of stressing on the fact that, oh, they're not following the same road that everyone else is, let them take the road that's, less taken. Let them go through that road. Let them have their own experiences. Right. The more we shelter them, especially from a speech and language aspect, the more we shelter them as well, right? The more they're not given opportunities as well. Are they given opportunities to play with other children? Are they given opportunities in a school to interact with other students? Are they, asked questions in a class? Are they, also interact with class, or are they just isolated? Which is something that we often see. They're just in a class and they're not spoken to. They're not given playtime with other children. They're just given some other alternative work to do. Right. So in a speech and language aspect of it, when we tend to focus on techniques or activities, with a child, right? It can be something as, it can be something as greeting. It can be, your pragmatics. Pragmatics is a communication aspect of it. Are they using their language? Are they communicating? Are they initiating a topic? Are they starting to give you attention? Are they taking attention and bringing your attention to something? So all of these things are important. But like Mitali ma'am also said, we as rehabilitation professionals see them for a limited amount of time throughout the day or throughout the week. So caregivers play a very important role in kind of shaping these techniques and these activities, right? Just because we do one activity, which can be turn taking in a session, doesn't mean you stick to only that turn taking. It needs to be generalized. It needs to be expanded. It needs to be explored in that child's actual life. How is turn taking happening, right? Are they taking their turn in their speaking? Are they waiting for you to talk? And then, are they talking? Okay. Are they listening to you? Are they using turn taking in an activity, maybe when you're arranging your fruits and vegetables at home after the market? Are they letting you do it, and then you maybe the mother can arrange the fruits or the vegetable, the potatoes, and then you're telling the child to arrange the let's say the onions? Are you giving that child space to do all these every daily activities? And I think it's important that caregivers and individuals around a child's life understand that these daily activities are very important to impart communication, speech, and language, right? None of us learn communication or language sitting in a room, right, talking and doing an activity. No, we learned language by interacting with other children, by interacting with our parents, with our peers, with our family, by being involved, right? Not being separated, not being only separated and giving specific activities. Instead, we have to give them opportunities to be a part of a regular dwelling society. If not, they're never going to learn these aspects of pragmatics or communication. They're never going to be able to read those intonations or those signs, because they're never given the opportunity to experience them. Okay. And in terms of speech and language and communication, there are a multitude of varieties where, if the child is not, if we feel like they're not speaking or they're not getting to their goals, or, we have to be able to give them an alternative mode, right? We need to be able to support them, to give them supportive communication, supportive language, because the most important thing, as I've been stressing, is the communication part of it. Are they being able to use a system? Maybe it can be an electronic system, it can be a picture-based system. Nowadays, technology is so advanced that there are so many apps, there are so many beautiful, beautiful things that you can customize for yourself so that you can impart this communication ability to your child. But the problem also is that awareness still needs to be coming, although a good amount of it has been there. There still needs to be a lot of awareness regarding the fact that, parents and caregivers should not stress after the awareness part. They should let the child be themselves. Okay, whether that it's speech, whether that's language, or whether that's communication, whether all their behaviors are also coming into place, you need to be able to identify the child as the individual, not as the diagnosis. A lot of parents get halted as soon as they hear their diagnosis, because, with, as I mentioned, with a lot of technology, we have so many ways of information, we have so many ways that we're reading, and, we just keep on reading, right? And we just think as soon as we hear a diagnosis of autism, or as soon as we hear a diagnosis of ADHD, we tend to just circle that child into this small circle and say, this is what the child is capable of. You tend to either undershoot him, saying this is all he's capable of, or you tend to overshoot him. You don't let the child be, right? So putting him in that circle and then having this news, whether it's a diagnosis, we need to understand that it's a spectrum, or, all of these disorders are a spectrum. Each child is individual, whether they have autism, whether they have ADHD. One child is going to be so different from the other child, because you have to take on the factor that their personality and characters are different, their needs are different, the environments are different, the barriers and the opportunities that they're being enforced upon can be different as well. And we need to make sure, whether that's only from a speech aspect or whether that's from a behavioral aspect, that these barriers are kind of we are really taking out these barriers and kind of giving them an assistance, an augmentation into their language and speech. Okay. And in terms of an age limit for children for speech therapy, speech and language therapy, there is no age limit, right? As we've already stressed upon, early intervention is definitely important. The earlier that we can start with therapy and intervention and rehabilitation is the best, because the child tends to pick up and process things much better when they're younger. Okay. And we tend to understand them when they're much better younger. As they grow older and we're not giving them any means of speech and language or communication, the frustrations and the behavior you tend to notice, because they're not able to get it out. They're not able to get other people to understand them. right? So the earlier we're helping them do that, the earlier we're helping them to be a part of society, the more we can enable them to reduce their frustrations and anxiety and their tensions, and to actually become active, participating, functional individuals in a society. Okay, and not just as individuals with a disability. Yeah.
Yes, yes, yes. Thank you, Sandra ma'am, for that answer. It is indeed like, as you have correctly explored and kept it in front of us, that everything, every communication is a part of a natural setup. It is never to be controlled or constrained in any of the aspect, because even we have learned it in our natural setup by following commands, maybe understanding intonations. Definitely, definitely. Uh, so moving forward, I would like to ask my next question to Sangeeta ma'am, who is a remedial therapist. As speech is also a part of a therapy, remedial teaching also goes hand in hand. So major times parents have this question, what is remedial teaching? And if Sangeeta ma'am could address that question, and also who can benefit it from?
Yes, absolutely, Shrestha. As you said, we also need to spread awareness about certain therapies, like what is occupational therapy, what is speech therapy, and in the same way, what is remedial teaching. So many a times in school, we see it is just taken as any other normal tuition class, and so the child is, even if there are remedial teachers in schools alongside counselors, so anyone who is not doing slightly well in academics is sent to the teacher. So actually, if you go to see, remedial teaching is about understanding the different needs of the child. Children who have different needs, like in CBSE schools, in SSC schools, or any other different boards schools, you can see in a classroom the child is just not able to learn or achieve the minimum competency level expected to achieve in the exams, and they are struggling a lot regarding their academic progress. And so sometimes what happens is it does take a toll on their self-confidence, their self-concept, and they are always honored or reprimanded at school, and sometimes it just takes away the motivation for learning or even going to school. So remedial teaching, we can say, is about specialized or additional or special form of instructions used for children who are struggling academically. So here in remedial teaching, the specific block is identified, the specific challenges or specific area of problem is identified, due to which the child is not able to learn the concepts taught in school. So there could be their reading skills or the specific area due to which the child is not able to, as we say, achieve the competency level. And all said and done, even if try to focus on their strengths, on their abilities, but as I said, in schools having these boards, SSC board, CBSE board, ICSE board, children do need to at least achieve the minimum competency level. And now with this, even though new education policy is in place, the changing GRs, that come now, initially the children were sent to next classes, irrespective whether they pass or fail in subjects. So, the parents and students were in kind of a comfort zone that, okay, come what may, my child or the student also knew that I am going to go in the next class. But now with the latest GR, which says that no, if the child fails in standard 5 or standard 8, will have to repeat that entire class. Or same in standard 12, in standard 10, 12. So minimum competency level is something which does everyone, we have to think about it, and at least ensure that the child is learning something in school. Though we are not concerned of very high grades and good marks. But if a child is struggling immensely in that area, then remedial teaching is something which comes into place, because as I said, we look at the specific block which is causing that damage, and the child is not able to learn. So there are steps in remedial teaching. So first step, as I said, would be identifying this block through various psychometric assessments, psychological assessments, and observations from teachers and parents and the students themselves. So from all these sources, when we have some information that where the problem is, and when we have identified the exact problem, then the next step would be to form an individualized education plan, that is the IEP, where an actual plan which is customized according to the specific need of the child, according to the specific blocks, specific challenges of the child. The IEP, individualized education plan, is prepared. It has short-term and long-term goals, as in we know till where we have to bridge the learning gap, where exactly is the learning gap, and till where we have to bridge it. So once that IEP is formed, the next step would be to plan the exact strategies and interventions, that will help us achieve our short-term and long-term goals. Now, these strategies and interventions are, such that they are activity-based. They are hands-on activities given to children. There are a lot of games and, interactive activities. There are a lot of, opportunities given for the child to actually have a first-hand experience, and it is a multi-sensory approach basically. So all this, a lot of visual aids are used, and all these things help to reinforce learning and bridge the gap. And as and when the strategies are implemented, the progress of the child is monitored very closely as to how the child is responding to these multisensory interactive activities, games, which are the strategies for the child. How is the child responding? And then again, there are changes constantly made in the strategies to ensure that the concepts which the child was not able to learn in his regular classroom, the child will be able to do that. And the remedial teacher has to work very closely, very collaboratively with the class teachers, with the parents, with the school principals, school counselors, to all the important stakeholders in a child's life, all the important caregivers, so that all these observations as to how the child is actually responding to the strategies, whether the needs are being fulfilled or no. So that is, it is very important. So that's also an important step later on. So that's how we slowly, first by identifying the gap and then by giving multisensory, activities and games, we try to bridge that gap. So it's a very collaborative effort, and basically it's not just a band-aid thing. Okay, if you are failing, so just do something so at least you pass. It's going to the root cause of the problem and trying to find the core areas of concerns and actually go on working with them. So as everyone has been saying, it needs a lot of patience and time, and it's not something that, okay, parents and teachers are in a mode where they want quick results, that okay, if the child is going for remedial session but he's still not passing, so again, just passing in the exam is not the final goal. The child also feels better when he is able to achieve the small achievements, are also celebrated in remedial teaching. A lot of positive reinforcements are used, so that as we say, a happy child learns. So if the child is feeling happy from within or confident from within, and as the child goes on responding to these strategies, and the gaps are being bridged, so that is important for us, the overall personality of the child. And this is all about remedial teaching and who will benefit from it. So, children on spectrum, on autism spectrum, because their needs are different and they do need a different form of instructions, different modes of instructions, different forms. So remedial teaching is very useful for, children on autism spectrum. Then children who have, problems with their writing skills, reading skills, mathematical concepts are not clear. So children having dyslexia, dysgraphia, dyscalculia, so any specific learning difficulty, for them also remedial teaching has proven very beneficial. And children having behavioral issues, I mean, who are over energetic, who are hyperactive, of course, kids with ADHD, because they do have challenges with their organizational skills, with their impulsivity, with their overactive behavior. So, which impacts, goes on impacting their academic performance, and that leads to all other problems with the child. Children are not accepted in the classroom by their peers, by the teachers. So even for children having behavioral issues, remedial teaching works, because a remedial teacher will form strategies to ensure that the attention span is enhanced. The child's focus, ability to focus, his memory skills, all these areas are taken into account when strategies are formed. So for children having all these kind of issues, remedial teaching does help. And as I said, because it addresses the core areas of the needs of the child. And that's how it's been going on.
Thank you. I hope like it has cleared the concept of what remedial teaching is, and also the set of expectations that people that they're coming for. Maybe they can like understand that how it is working and what is the complexity of it. That it's not just a co-curricular activity, but it has a very in-depth contribution to it. So thank you, ma'am, for your response. Understanding schools and its functioning is important, and also the law, the system that we are in functioning right now is as important as. So here the next question is for Anita Iyer, ma'am. So ma'am, how can we address barriers and biases that often limit the opportunities available to individuals with developmental disabilities?
I've been listening to everybody speak, so I think we are all in agreement that it begins with the parents, and then the families, and then the community in which the child actually lives in, and awareness among all of these, and every member of society. That's why I say Ekansh time and again. Each of us is a part of it, and everybody plays a role. So when you talk about awareness, I basically, like I keep saying, that what you see is what you understand. In very even in marketing, they say कि जो दिखता है वो बिकता है, right? So you have to be able to see people with. If I have never met anyone with autism, let me go back many years, several years, almost 27 years, when Action for Autism had just been started by this wonderful lady called Mary Barua. And I was a newly married bride in Delhi, and I started volunteering for Action for Autism. And I said, I would love to take your son home with me for Diwali. Why don't you visit me for Diwali? And not knowing what would trigger, different responses in her son. I had no idea. I didn't understand autism at all. But I was extending an invitation for someone to come home during Diwali, where the triggers are maximum in terms of, patakas and sounds and smells and all of that. And she sat me down and explained. She said, if you want, you can take him home, but you have to be responsible for him. And then he walks into the room. I hadn't even met him. So the intention was great. But did I actually understand autism? Because India was just beginning to understand autism as a separate disability then. Mary was the one who spearheaded the entire thing. So I didn't know much. I was also volunteering at the Delhi School for Blind Students. I had just newly moved to Delhi. So I just wanted to get into everything and start volunteering wherever my services were needed. And there I have actually written a blog about this, where I told one of my students who was blind, I said, I have to go home now. It's getting dark. I should have said getting late. I didn't sleep all night because I had used the word dark instead of late with somebody who was visually challenged. And then next day I went back and I apologized. And he said, it's okay. We understand what you meant. We know that it gets dark as it gets late in the day. So a lot of times we beat ourselves up about having used the wrong words or about having said the wrong things. Awareness will not come very easily unless you really start interacting with them. I learned that I should have used the word late instead of dark by interacting. I have already said this earlier. So awareness spreads with interaction, and when the fear disappears, and when you're not trying to sugarcoat everything that you're trying to say. This is a new thing now. There's something called toxic positivity, where everything is positive. They are saying disability is a gift, and I know that every parent and every person with a disability in a heartbeat will return that gift. No one wants the gift. Let's be honest here. I have never met a person with a disability who says, "Oh, I love it. It's a gift." You're just saying it. This is toxic positivity, right? Everybody wants to get rid of the barriers in their lives and live a comfortable life. So all we have to focus on is how to be honest in our efforts to make the world an accessible place and an inclusive place. Honesty, patience, awareness, learning. We have in my when I was growing up, I had no excuse. I had the excuse that I didn't have enough information. Right now, nobody has an excuse because all information, everything that is being said here, has been said 100 times earlier by all of us. All this information is available online about awareness. What is early intervention? What is a developmental disability? All of this is there online. So anybody who wants to educate themselves will be able to find this information online. What we need to do is show them the human being with these who has different challenges, and what are the challenges that we are putting in their way. Do we really need a child with a disability to understand geography, or to understand geography of the world, or to understand where the refrigerator is in the house, to go and help themselves to a glass of water? Should the child know how to go to the toilet? Where is the toilet? How do I use the flush? How do I use the health faucet? How do I use the toilet paper? How do I leave the toilet clean when I'm coming out of the toilet so that the next person can use it? Are these the required skills? Or what does, when you combine an acid and an alkali, what do you get? Is that important, or is this important? So getting your priorities right is extremely important. The child should be as independent as possible, because every parent has only one worry. Even parents of children without disabilities have only one worry: what after me? What will happen to my child after me? So what are you equipping your child with? And while academics are very important, I will not deny that. First thing is, can I take care of myself? Can I get from point A to point B with as little help as possible? Are we putting up any barriers? So I was making notes as I was listening to Rucha speak so beautifully, and also, one second, I've just taken this down, and also Sandra. So, Sandra, when I actually started ACANS, we began with sign language classes for everybody, people with and without hearing impairments, because I believe that everybody should be able to communicate in different ways. Also, there is a lot of research that proves that the brain does not actually favor any one kind of communication. When you're growing up between the ages of 1 to 6, your major developmental years, in that phase, all the information that is collected in your brain is important. So whether you're using sign language or gestures or drawings, whether it's audio, visual, smell, everything is your core memory, which will serve you for the rest of your life. And the brain does not discriminate. It does not say that everything has to come in through language and has to come in through speech. All information is collected through touch, through smell, through taste. All of this is developed in the first 6 years of a child's life. So at this point of time, it's very important that we cater to the child's intellect in different ways. If the child is not able to hear or express, how do you offer that child communication? So total communication has to happen. And in India, especially, of course, sign language is still developing in India, and we don't have the full, complete vocabulary that we need for all subjects. But it is amazing how we, in any case, even in a cricket match, if you watch my TED talk, I started with that. In your cricket match, you know how to say 4 runs, you know how to say out, you know how to say the third umpire, you know all of that. But when you want to communicate with somebody who can't hear or speak, we suddenly become very reserved, and we want them to follow the conventional way of communication. So exploring all of that is so important. I was just writing this down as Sandra was speaking. Rucha spoke about early intervention. So there's what we do in the slums with the Anganwadi workers, especially because that is like the kindergarten in the slums. We talk about prevention, detection, and early intervention, because Anganwadi workers are in touch with entire families, the whole slum. Most of them work in the same slums in which they live. So they actually know families of children and adults with disabilities. So we talk to them about how to prevent the disabilities that can be prevented. How do we recognize them based on the milestones, developmental milestones? Because if the doctor gives you a list of developmental milestones for the next 3 or 6 years, they don't explain what happens if the child does not reach that milestone at the right time. What does it indicate? What are you supposed to look at for example, hemophilia has now been included as one of the 21 disabilities. So even while a child is learning to crawl, if there is bleeding inside, internal bleeding happening, and the child has blue patches on the elbows and knees, and people start saying malish karao, let's get massage done, and then it further damages those joints, right? So awareness is missing to such an extent. we talk about special education again. Why do you have special education when you're talking about inclusion? Every teacher has to understand how to recognize a disability in a child in the classroom. So at least some part of the syllabus has to be on different disabilities and what are the signs. And the teacher doesn't really have to do much other than just alert the parents to go and meet with the developmental pediatrician to understand what the challenge is. And then the pediatrician will further refer those parents to whoever the experts are in that specific space. Right. So, and at least being able to recognize that and being an ally to the parents sometimes may not have recognized. But if the teacher has, giving him or her the freedom or them the freedom to actually express this to the parents. Schools should also have these policies where open discussions should happen. Many teachers are very afraid to tell the parents that your child might have a disability. So, and the parents may also not tell the school, because what if the school discriminates? So this whole feeling of stigma and embarrassment has to go. And again, that will happen only through social interaction, I think, where people start speaking more freely about disabilities, and the word disability is not seen as a bad word. You say specially abled and differently abled. Everybody is differently abled and specially abled. Nobody here has the abilities that I have. I don't have the abilities that all of you have. So, sugarcoating words is not going to help. If you need a ramp, you have to say you're a wheelchair user. If I need a sign language interpreter, I have to say that I am deaf. So for you to get the facilities that you need and the resources that you need, you have to explain what your disability is. I have asthma. So tomorrow, if there is a fire somewhere, people around me have to know that I'm somebody with asthma. So acknowledging and revealing the disability is very important. And it has to become a rule where parents cannot conceal information or withhold information from the school. The teachers also should have the freedom to explain to the parents. So this open discussion has to happen, and a lot of such workshops have to happen in person. I think so that conversations begin. So we have storybooks and coloring pages where children which we distribute in all schools, where children without disabilities, as they're coloring, they need to ask questions. So every picture has a character with a disability. Every story has a character with a disability. Unless conversations start happening at the dinner table about disabilities, it is not going to spread to formal spaces like schools and companies, I feel. So we have to normalize the word disability, and it should be used without any stigmas. And caregivers, I think, also need self care, and they need to be equipped with all the information and the resources that they need. And in Pune, when we had this meeting with caregivers, we realized that others may not understand very easily. It's always the parents who understand the children best. So a lot of buddy centers have to be created where parents of children with the families and caregivers of children with disabilities and children with disabilities get together, and it's like a club, and they have to be local. So a lot of information is traded, a lot of things are understood, a lot of conversations happen without any stigma. And then as a group, they are able to, like we have Naidisha in Pune, we have Youngistan, and we have Buddy Center in Pune. All of these started, we have had conversations around this many times in Ekansh. Parents have come and we've had conversations, and I've said, nobody can do it better than you. Because every child with autism is an individual and very different from another child with autism. Every child with ADHD behaves very differently from another child with ADHD. So you can't generalize these symptoms also when it comes to a lot of developmental disabilities. So therefore, I think these family clubs really help, and counseling, of course, is extremely important. So I think all of you play such great and important roles in making society aware. If we could just spread this a little more and have more meetings and more online discussions, I think that would greatly help. Thank you.
Yes, ma'am. Sure, sure. We will take this as a note that we have many more such occasions to follow through so that we can open this forum, this platform to discuss about the awareness. So, as ma'am has rightfully talked about uh, the family and the caregivers that need to be equally paid attention to. Uh, so, here is my next question to Dr. Tali Reddy, ma'am. Uh, what resources and support systems are essential for families and caregivers of individuals with developmental disabilities to help them navigate challenges and assess opportunities?
So definitely, it'll all begin with the family first, because when you get the diagnosis, and sort of it is definitely a shock in the first go. It is definitely something which you have not prepared yourself for. But then if the family is around you, they're like, okay, fine, we'll deal with it. However it comes, whatever things are coming, we are all together in this. Then it really reduces the burden on the parents or the immediate family also. So that is one thing which is very, very important, that there's no blame game anywhere. And particularly mothers, many a times now we see in around our groups also, that most of the mothers have had to sacrifice their careers because it was not possible for any others to give that kind of care. And as rightly pointed out, the fathers are supposed to be the providers, although they do they take part in the caregiving and whenever the opportunity is there. But then yes, many of the mothers have had to sacrifice their careers. So really need
Ma'am,
to
you're
know that they need to appreciate for whatever efforts they are putting in, because sometimes it so happens that even if you're doing everything, you may not see the kind of results the others are expecting, as the child will show improvement. For you can appreciate that, but maybe someone else who is there from outside may not really understand even the little steps of improvement which are happening. So sometimes particularly when the children get older, that is the time, see, your peers sometimes they are now leading into, because their children are independent, so they are able to do things which you are not able to do, because the child has grown in age. They have improved their skills also, but sometimes there can be some behavioral challenges which have not really gone away, some new challenges which have come up with the increasing age, the onset of puberty, and there's so many more challenges which come up which have to be addressed. And so that is the time that they're, I mean, at the time of diagnosis, in between, you're at least focused, on the schooling, on the therapy. At least there is some purpose. But as the children grow older, sometimes those times can be even more challenging, because now their age group, their other children are becoming independent, but they may not be so independent. So you are also still you cannot do the things that the others of your or your peers can. So that is the time, and then again you have almost given all your life to doing things, and you have nothing really to show for that. That okay, what have you done? It happens. So if the parents are not, if they're not if this is not the case, I mean, the family is appreciative, and then this will not happen. Then they know at least that, okay, whatever efforts they have been put, they have been appreciated. One more thing which we have done, I am from Thane, and we have this group called Rajahans Foundation, which is an organization run by parents of children with autism. So it's all started initially as just a support group, where we would come together, have meetings, talk about things, have some lectures by experts, and that's so the parent training was there, as well as then we started with children workshops. Soon we started with a vocational center, so we could be a part of that, because many of the adults sometimes they don't know what to do now. There are for till you're say 17, 18, you have schools, and after that, but there is a real question as to what next, because there are, okay, we do see that many opportunities are being given now to children with adults with disabilities, but with autism, maybe a very few percentage of adults are actually able to work outside. Many of them have very good skills, but still it is difficult for them because of the behavioral challenges. It is really not very easy for them to work outside in a in an outside setup. So for them, we have now started, I mean, we have this vocational training now, which soon we want to start as a sheltered workshop where we can give them employment with whatever requirements will be there, because at some point some of the challenges will never go away, or they can be managed, they can reduce, but let's accept it, it's not going to go away. So fine, why should the other skills will not be given a chance only because of that? So give the support that they need, and you see the things that they can do. And I think it is very rewarding as parents to be a part of that entire thing. And even small victories, that suppose if even my child is learned, suppose to be the entire Torrent in 1 year, I am very happy, and I am not only I am happy, I can see my joy shared by other parents who know how important it is. So that sharing of joy is what we really need. So for us, this group that we have is like a family apart from our own family, it's like a second family. And I believe that that has helped us, many of us, a lot, where we can share not only our joys but also our the sometimes some new challenges come up and we are worried, and the other person is exactly going to know exactly why that, I mean, what is the magnitude of that worry. They'll be able to tell you it's okay, it happened to me also, and then we did this, and it went away. So many of us, when our children were little, we saw the old elders and the older children and adults, and they said, my son was just like this. And it gave us a lot of hope. Ki, okay, maybe there are a few more challenges, but there's a lot that we can look into. If he's able to do this, okay, my child will also at least try, and somewhere there'll be some improvement. I mean, there will be some skill development, and that is going to be there. So it was a lot of hope that we got from each other. And of course, I feel that apart from this, if any parent is really facing a like anything which can, the symptoms which account to depression, or there's some severe anxiety, I do believe that they should take professional help. But all of this, but again, I feel that professional help will only succeed if it is maintained later with this kind of group that you have, people who understand you. So I think that is very important, that if you need, you do take help, but you have a peer group, sort of people who are sailing in the same boat like you. So that makes a whole lot of difference. So, I have shared a clip. I don't know whether you want to play it now or maybe later. So it is, we mainly work with adults with autism and some other intellectual impairments like slow learners and all. So I've just shared a clip of our vocational center. So if you see in that clip, you will see them working, focused on the whatever they're working with, different kinds of vocational skills that they're doing. But I mean, behind this, there are a lot of challenges that have been handled. But if you see them doing that particular skill, you will see them that for the things that they can do. And this is what I feel we all need to focus and celebrate. So then I think that, and I feel that the children do pick up on our vibes, that how we feel about them. If we look at them with, we have that appreciation, look at them with pride, I think that they quickly catch on it and they want to do that more. So that also helps in how they perform. So that is all.
Thank you, ma'am. Actually, it is something that parents would find it very resourceful, as uh, if I can associate with someone with going the same situation, then it is very easy for me to get related with them, because then I can be like, yeah, sure, okay, I'm handled, I'm been taken care of, I'm been understood at times. So
There's
definitely.
one more point I feel, that I think there also should be resources, in the sense that where, now we as a parent group, we are looking for a residential community which we do not look at it as, I mean, which will be now creating for our children, because at some point of time you need to see them. Eventually there is going to be a time which is after us, like, because there is going to be a time that when we may not be around, but we need to be sure that they will be cared for and they will settle in a space where they do not need us. So we have now bought a piece of land and we are going to construct. So initially, even we used to feel, why do we need to keep our children away? But it is not so. We look at it as a next step in their lives, because all of us also came out. I mean, we just also went out of our parents' houses and did something for ourselves. So we also look at it in that way. It is not something that we have to just keep because we cannot manage them. It is not like that. We will be an important part of even like or their life over there, but we will help them settle in a way that they can be looked after without us. That will also give the other parents some time to lead some independent lives where they can have some me time for themselves, do things which they have not been able to do, and their children will be well looked after and will be indulging in like productive lives, functional, and be an important part of the society.
Definitely, ma'am. That is addressing a very brief question which many caregivers would have, that what after me? What would happen to my child? So definitely, ma'am. Thank you. Thank you so much for the response. Uh, So, with moving forward, the next question to again Anita ma'am. It is about how can policymakers and stakeholders collaborate to implement policies that promote equal access to education, healthcare, housing, and employment for individuals with developmental disabilities. So, can we talk about the UDID card? Explore like how it is going to be beneficial for developmental disabilities.
So the UDID card is basically an identity card, like an Aadhaar card, but it mentions the disability of the person who has the UDID card. It's important not only because, basically what happens is when we go and ask the government or a municipal corporation or even a corporate, a company for funding or for sponsorship, the first question they ask us is how many people with autism are there in our society? What is the percentage in our society of people with autism or people who are visually impaired? If they say, if you go and tell them, why don't you put up a ramp for a wheelchair user, or why don't you have handrails for a person who uses crutches? They'll ask how many people will come to this space. Koi nahi aata hai. Nobody comes on a wheelchair, so why should we put it up? So it becomes a cycle, where there is no accessibility, so people with disabilities don't go, and accessibility affects the number of people who actually access all these places, and when people don't go, people feel they are not there anymore. It's like women were never engineers, right? So why should we have engineering seats for women? That used to be the thought process earlier. So I keep comparing this whole struggle to the gender struggle that we had while we were growing up, or our seniors, my the elders in my family, the women in my family. Why would you enter a space where women don't actually? How can you even have an? The question is, how can you even put your needs forward in front of men? It used to be like that, where men never understood the issues that women had. For example, in one of the companies that I worked, we had no dustbins in the ladies' toilet. Nobody knew why dustbins have to be in the ladies' toilet in a company when I was 2021. I went to the boss and said, ask your wife, we need a dustbin. And then the next day there was a dustbin there. So awareness is missing. So why do you need a ramp? Why do you need resources? Why do you need therapy? Because people don't know. It's not because people are evil. It's just that they're ignorant and nobody has spoken to them about these things. UDID card makes sure that you have your identity card, which says that you have a particular disability. A lot of incidents happen at airports, etc. Nowadays, you see parents are complaining that the children with autism are not treated the same as everybody else. Has the person actually met someone with that disability earlier? And how much did you know about autism before you had a child with autism? Let's be a little kinder to society because people are ignorant. Let's not immediately go into this whole blame game thing where we are saying, oh, you didn't do this or you didn't do that. Policy making matters. Policies are being made and implemented wrongly because of lack of awareness. So a lot of these, Mithili, especially, I would request you and I would request Symbiosis, let us get these groups of parents to conduct sensitization sessions for people in the airports, people at railway stations, people in the bus stations, people in common areas. For example, even in a mall, how can these shops be more accessible and more inclusive and more welcoming to people with different disabilities? They don't know and they don't understand that they're missing out on a big a chunk of consumers who would want to visit these places, right? So understanding disabilities is very important. I think we all have to take awareness, and awareness spreading as extremely important. Don't say that nobody's going to understand us, let's not bother. You must bother, because unless people understand, they will not make a change, right? So policy making and all of this will begin with awareness, and we have to start getting together and writing down everything that we need and approaching the local authorities with the changes that we need, with reasons why we need them. Like I said, if we can form groups, which is what Ekans tries to do all the time, if we can form groups, pressure groups, where parents of children with autism go and approach the municipal corporation or the government of India, the education department or wherever, and they talk about what their needs are and they explain why these changes have to come. Unless we do this as people who are directly affected, change is not going to happen. So to affect policy, we have to get involved. We can't expect the government to understand us. For example, the government of India has come up with a list of 21 so-called disabilities. Many of those are not even disabilities. They are health conditions leading to disability. So they have put acid attack survivors as people with disabilities, but not burn victims. there's nothing about obesity. Abroad, when you go, obesity is also a disability, because if you are overweight and you have to come down, if there's a fire, if there's evacuation, climbing up steps becomes difficult, breathing becomes difficult, walking at the airport, you may need one of those, what do you call them, golf carts, to get from the entrance to gate 17 maybe, because you are obese, but nobody's going to see that as a disability. But you do have a problem in mobility, getting from point A to point B. My asthma causes that. Sometimes I can walk, sometimes I can't, I may need it. So am I not entitled to the caddy to be taken from point A to point B? These are all questions that will be answered only when there is enough awareness. We also conducted a session. I mean, there are occupational therapists among us, so we conducted a competition in adaptive clothing design for students of fashion design. How do you adapt clothing for persons with disabilities? They are all designing only for size 0, and these models who are coming on stage and wearing the same lehenga and the same small short clothes. What about persons with disability? Have you learned how to design? There are people who have got gold medals in fashion design who do not know how to design clothing for a wheelchair user. So people are getting out of IAS officers, for example. Who's our disability commissioner? Our commissioner in the Department of Disabilities is a person with an IAS degree. Has he heard about the 21 different disabilities? But it was not a part of his training program. Every training program, any profession, whether it is management, whether it is an MBA program or a BEd or a DEd or an IAS, every training architecture, for example, how do you design a building for people with disabilities? Symbiosis is an accessible campus. I know because I come there often for sessions, etc. And my daughter studied there. I know you have an accessible campus, but every space has to be accessible. How does the architect, the civil engineer, every course has to have a component of inclusion, inclusive design, inclusive training. How do you design a syllabus? Inclusive. So that word inclusive has to be understood by every professional. So when you talk about policy change, it begins with awareness, and it begins by becoming a part of your training programs and your academics right from the start. You can't retrofit these things. You can't say, oh, after 50, I will become inclusive. You have to be inclusive from the day you are born. And that will only happen when every course, every individual, every adult today has some understanding that people are different. Maybe you don't understand the names of the disabilities or the symptoms, but to know that everybody is a different human being and everybody has different needs, and how to be inclusive. We used to be taught moral science growing up. That has stopped. All of that has to be brought back. So education cannot only be about how to do good, how to do well. I keep saying this when I do my workshops for architecture and other students. Many people will come and teach you how to do well. We also have to be taught how to do good right from day one. That has to become again a part of our academic syllabus, how to do good for everybody. Thank you.
Thank you, ma'am. That was really amazing to understand that how we, as being a common citizens, also play a lot important role in understanding these policies, and also contributing onto it. Uh, Talking about the interventions, and we have spoken a lot about families. Right now, we have even seen the policies. On an individual level, there might be some of the interventions or strategies which we can use in order to cater and see that the person with developmental disabilities is benefited from it. So my next question would be to Dr. Rucha Thorat, ma'am. What role do strategies of promoting effective independent living skills and self-advocacy among individuals with developmental disabilities?
Thank you. Am I audible? Yeah. Thank you for this question. But this is too a big and generalized question, which can't be answered in such a short time. As Anita Madam has rightly pointed it, and like that word that we have to stop being toxic positive, and those sugar-coated words for children with disability don't often work. And independence is something that has to be nurtured right from the early age. Most of us in our culture and tradition, we're being fed always by our mothers at least till age of 5. I don't see. I mean, when I have to do feeding intervention for somebody, it is like I have to ask that mother, can I? Because he has an issue, but mother often says no, he does not have issue. He's being fed by me. Majority time when I do my questionnaire or data collection or information for myself that what I have to do with that child, most of the time the mother has answered me that he's not been exposed to or not given an opportunity to do so. So how are we going to develop an independent lifestyle or make that child efficient in whatever abilities or capacities he or she has? So first and foremost thing that we have to understand is make them child learn through own experiences, however he can do, with or without modification, with or without assistance, with or without supervision. He has to use by his own hands. He has to learn to use his own hands. Then only we can move from being unable to enable. I mean, unable to enable. Otherwise, it will be just we've been doing interventions and forgetting about it, that the child has to use this whatever the therapist has given them in the intervention to in his real life. So as I said, you can use assistive spoons or adaptive devices to make the child have used the spoon if he cannot use the hands. If he cannot sit, help the child to use a modified chair or some cushioning or some strapping or some arrangement in the home itself. If you cannot afford to have a modified assistive chair, if your environment does or your architecture barrier doesn't permit you to have an assisted chair in your house, but you can make some assistant by cushions or some corners or making his back erect, whatever the posture has been recommended by your therapist or doctor. Maybe it requires assistance initially. Give them that assistance and help him to feed himself. If feeding is just an example, I mean, there are many other things that the child can do at home. Suppose there is a skill of, say, writing. Many of the children have difficulties in writing, and so most frequently what you say a visitor in my clinic that my child is not able to write. So instead of not able to write, you have to understand why not able to write. Is his hand grip is poor? Is his posture is not supposed to be? Is the vision is not helping him? The processing is not helping him to write. Can we give him some aids? Can we provide him with some visual cards? Can we provide him with some writing assistive devices so that it becomes less taxing or less burdening for that child, and he may develop interest before losing it, that I'm not able to write and running away from that task altogether. So these are the small steps that one should carry out at the home setup first, that let's help with each other's help, that okay, let me see how you can help yourself eating. Let me see how can you assist me in dressing. Let's put your upper garments together. Can you help me in assist giving your hand into your sleeve? Yes, you can do that. So break your task into smaller components. There may be a long-term goal as my child can dress up independently, whole upper and lower garments. But there can be a short-term goal of just, can he remove the socks? Can he remove the shoes himself alone? In assisted sitting or in whichever posture possible for him. Just start putting that down, and my child can do this, and help him towards that independent step first. So unless you take that first step, the child is not going to learn and not going to get a feedback from his own body mechanics how to do it. If he doesn't have the feedback loop, if he doesn't have the sensory experience of doing that movement, he's never going to do it. So you have to make the child do it with or without help. That help could be physical help, that help could be your verbal cues, that help could be your demonstration, that help could be just putting hand on the child's body. It could be any assistive devices or aids. So, but give him that help which is required at the initial step. The child learns the self-confidence. Okay, I can do it. That could be a small joy. I did it. We did it together. So give that opportunity to the child very early on, before coming to me at 10 years of age, and when I learned the girl is not able to write, and then I discover, oh, she's not even able to tie shoelaces. She's not able to tie even a ponytail, not able to comb her hair. Why? So why that opportunity was not given to the child when she has the ability? Maybe she may do wrong initially or somehow unkempt initially, but yes, you can always correct it with her. So giving that opportunity by embracing whatever abilities he has is the first step towards moving towards independence. So providing opportunity early, understanding their behavior, that is another thing. They may be getting frustrated because they can't do it. The behavior is always a communication to something. So understand that behavior, that why is he behaving this way? Does he want to do it in a certain manner? Is he struggling? Is it too taxing? Is it too burdening? Does he need help? That's why he's screaming. That's why he's flapping, or whatever he's through. That why is the tantrum of not able to do it efficiently. So how can we tie up together with the therapist, with other school teachers, with other policymakers to bring it together? Okay, my child needs this. How can we help to become more independent? So then that help will come on your door. We have to be open in talking about it. Then only you can advocate yourself. So your second question was toward advocacy. Unless parents open up that my child has a difficulty in doing so. Most of the parents come up, yes, he does it with me, but what about the other environmental setup? He might be comfortable in the home setup, but not in the school setup, not in where he has to go and work. So can he generalize that experience towards every environmental or a context that he has to function? He may be able to walk in the house with the walker, but is he able to do the same thing at the school level, on the road, in his park, at the playground, at your corridor, your building apartment doorway? Can he do there? So you have to give that experience everywhere for that child and be open that my child needs help. Do not hide it, do not mask it from whichever environmental context that you're going to go in. Suppose for a little bit grown-up child, writing notes is a difficulty. To advocate this function for that child, that he has a difficulty, and how do you learn self-advocacy? You learn it when you understand it, when you are aware about it. So you have to be self-aware about your own needs first. If not, the child is too young or is on some IEP or early intervention program, the parent has to understand it as a co-regulator or caregiver, that my child has difficulty in this. This has to be aware by parent. Again, the awareness comes in the picture before self-advocacy, that I'm aware of my needs. Then, yes, you are aware of your needs, then what next step? Are you able to communicate those needs? So you should be able to communicate those needs cognitively, that my child has difficulty in XYZ, or the child is grown up. When you bring these points to the child, you have this difficulty. We need to use this to ease you up. So not to shy away from his difficulties. My child needs a writer. My child needs an extra time for the examination. Or my child has a difficulty in vision, so he may need this visual aid to process the information at the school level. So then only those aids will be given to you at the school level, will be accepted by the school authorities to have your child on the board and use this assistive devices and whatever available resources that the child needs in that context. So then is the communication, self-awareness, and communicating these needs to the society. That is also equally important. That child will say, okay, I can't take such big notes, but can I record it? Or can I use it in other format? Can I have a writer for this? Can I take another subject if that is a facility available by our boards? That one need to explore. So child has to say, I cannot. So child should also be made aware that I have a difficulty in writing, so I'm using this type of boards. I have a difficulty in communication. Can I give my child an augmentative communication boards as said by Sandra? Can he use alternative modes of communication, which should be accepted by everybody? One has to plan very early a planning, organization, and problem solving task at home. That is how you're going to build up your repertoire of experience, that okay, this is what happens when I do this. This is how it leads to when I'm walking, when I'm stepping up, when I have to cross in hurdle. This is what is my experiences, and how do I maneuver the obstacles? How do I problem solve around the difficulty? That will only come when you make him do things in his day-to-day life. Forming a visual schedules, having visual checklist might assist child in his day-to-day function, that what is coming next. So these are the certain things that help him to become a little more efficient or independent, or may feel or forget even those words, may become comfortable in what he has to do in his life. At least he knows prior hand that this is what I need to do. This is what is coming up next. That is what a visual schedule and checklist will provide that child. Break down the task into smaller components and have your long and short term goals. Always have some goals for your child. You can't always just, we are doing this exercise because we have to do it. No, that can't be very welcoming by the child. Why the hell I have to do this thing? But you have to explain the child that you do this, you may be able to go to a football ground. You may be able to hold the bat in the hand. You may be able to play with the peer groups with support. If you explain them the why of what you do, it becomes more easier for a child to accept that whatever going on in his environment. So I think you have to have these three elements of self-awareness, communication for self-advocacy, knowing what kind of communication system you need in your environmental context you need to perform. You have to start very early. It can be started at any age, but early is better. Don't use sugar-coated words always. That is must. Visual task, visual schedules, visual checklist, use of alternative modalities for communication or for emulation or for mobility is must to start on. Don't wait for it will happen sometime at the age. No, start at whatever point your child is. It make him feel independence. So these are the certain, I will generalize guidelines that one has to follow, because every child is again unique. If I have to sit and write what one particular child has to do, it will be a different program from child to child, because no two children are same. Even no two children, take for example writing as a function, a child will have a difficulty writing because of so many other issues, and the B child will have difficulty writing because of so many other set of parameters. So the strategies differ from child to child. It will differ from what the children's abilities are, what is their neuropathology is, what are their strengths are, what are their weaknesses are, what does the family set of goals are, what the family wants, what the child wants, what the school wants. We have to take into consideration the entire environment to plan the strategies. So this is my short answer for how to make your child independent and self-advocate for your child. Do not hide, do not mask, be open.
Definitely. It is something that we can go on, and the list would never.
And we all, I think, coming down to same thing, that be open, move from inability to enable person, and do not mask, start early. That's what we are coming to have awareness into the child's condition, be more curious. Just don't gather information from whatever available. I've agreed to Anita, and it is all available, whatever we said. But this information is of no use unless you put to use in a right manner. Everything is available today. Yes, many activities are listed on YouTube. I know, and social media, and every platform they are available. But unless what your child needs is different, it is not same as what has been shown, or it is not same as what has been listed always. So try to use this information and convert it into knowledge for yourself, not just read it and take it in and don't filter out about for your child. That is a little tricky.
Definitely. Knowledge comes with application, and if not applied, then what is the use? Definitely. So thank you, ma'am. Thank you for giving this wonderful awareness about the ideas and the strategies that parents or caregivers or even educators could advocate to the people. Thank you, ma'am, for that awareness to us all. Now, moving ahead, I would like to address a question to Sangeeta ma'am and Sandra ma'am. The question comes here is, how can we empower individuals with developmental disabilities to become advocates for themselves and their communities?
Yes. So, Sandra, who would like to go first?
Yeah, sure. So I think being self-advocates, that individuals with developmental disabilities are their best people to advocate for their own individual needs and rights and opportunities, because they're the ones facing the problems. although we as rehabilitation professionals or caregivers and individuals in and around their environment have a certain up to a certain level and a good have a good understanding about them and what they need, since we've all been seeing them usually mostly from a very young age to throughout the developmental ages, we see them and we tend to have a good idea about them. But they're the ones who know themselves, they're the ones who know their personality, they're the ones who knows what they like and they don't like and what they need from us as caregivers, from us as professionals in their life, from us as classmates, from us as their grandparents. They're the ones who know what they need. So they are the best people to self advocate for themselves. But as professionals and as caregivers, what we can do is, I think, as we've already discussed, this has been the general trend of our conversation. And the topic of our webinar today was to provide them with opportunities and not to hide them, not to protect them, not to, I mean, of course, we must protect them, but not to just shelter them too much. We should let them live their life with their experiences, let them communicate with other individuals, let other individuals communicate with them. Then only can individuals understand, in general, the general population can understand that these individuals can also provide and be effective participants in the society, right? Because especially as young children, I think when we're youngest, when we're very young, we tend to take our experiences much more into heart and we tend to develop onto them, right? So even as young children who are in school, with an inclusive environment in the education setup as well, they tend to be active participants and actively involved with children with developmental disabilities as well. And they tend to understand what are their problems, their needs, how they can also facilitate their needs as well. And that can also help. So peer group support, in the school can also empower them to become self advocates and advocate for their needs and advocate for individuals with disabilities, and to help children also understand why, that they're not very different. They just have a different need. They just have a different way of communicating or speaking or, doing certain things. That doesn't make them, something, another entity altogether. That they're also a part of us. They're also a part of this society that we are there, and they're not something different that, we don't need to isolate them. We can also try to interact with them. Only when they are part of society and we give them opportunities to be a part of society, do individuals in the society also learn how to kind of interact with these with individuals with developmental disabilities, how to cater to them, how to provide opportunities to them, how to talk to them, how to communicate, what are different methods of communicating with them. Sometimes speech might not be the answer. Sometimes they might not be able to, we might not be able to get to them with speech, or we might not be able to have a regular conversation with them. So what can be an alternative modality that we can use? All of these concepts only come from them being in part of a society, right? Only when you have an individual with a society with a, sorry, developmental disability in and around your group, do you understand all these things? Do you understand how they need, how they function, what are the needs, right? And individuals with developmental disabilities are their best advocate, right? I think all of us see on so many platforms such as social media where there are so many individuals with developmental disabilities actually speaking up now. They're given the opportunity to speak up for themselves, and it's so nice and so enriching to see them and to hear their experiences and what they've said. I've seen multiple and I follow multiple individuals who follow into the autism spectrum, and as they grew up, maybe they were completely non-verbal, as they were very young, but then they became verbal, and they, with the help of rehabilitation and with the support of their caregivers and families, they have come into places where they become public speakers, and are actively advocating for themselves, for individuals with disabilities on so many public platforms. And it's so wonderful to see that, because what happens usually is whenever we hear the term disability, we tend to just undershoot them, and we don't think that these individuals are capable of much, and they tend to just embark this sympathy from the general population that, oh, I don't know, they'll be able to do this and they'll be able to do that, but you know only that is a problem, right? And then only when you see these characters coming in and actively advocating for their disability, do we see that no, it's so much different. The spectrum is so wide for what they can do, and the the opportunities and the skills that they can actually use are so wide. And you, as we were talking, each child is different and they have such a different set of skills. I see children who, they might not be able to form a sentence, but they're so good in their visual, spatial, artistic skills. They can draw wonderful things. Okay. I had a child who can draw their entire, I think they've been one to a, to, I think it was an arcade center, and they've been there once. And he could draw the aerial view from that arcade center after just going once. So, and there's another child who's musically so gifted, you know. So we should be able to nurture these talented skills for them so that they can evolve into, such brighter, such holistic individuals that can actually be a part of the society, and not as someone just catered and defined as a person with disability. So I definitely think they are their most best self advocates, and only if we cater to their needs and individuals can they come forward and actually speak up on, or be able to show the world the things that they can do. Yeah, I think Sankita ma'am, I think you can continue.
Yes, definitely, Sandra. I think we all resonate with what you have said. And so what I will do is I will put all this discussion in a nutshell. I'll just summarize it by saying that yes, individuals with developmental disabilities can become advocates for themselves and others. So if we as caregivers give them various opportunities, mainly opportunities is what they need, that will empower them to voice their needs, their preferences and concerns, and that will contribute to a positive change. So whenever we get an opportunity, what we can do is we can just effectively communicate with them, even in social events and other functions, rather than avoiding them or not shying away from them. Just interact with them, just give them that opportunity. Just to the parents also, we can tell, to the class teachers, to the even counselors and remedial teachers, work hand in hand to just enhance. So not only that the child has come, so we have to focus on any one area according to his disability, but we can also focus on how we can enhance their communication skills. They can communicate, as Sandra has been mentioning, they can communicate in many other ways, but we should give them that opportunity where they can tell what they want, what they don't want, what they don't like, what they are comfortable with, and what they are not. So just give them that opportunity and try and enhance this communication skill. Help them to be assertive. Assertiveness training has to be given from home and everywhere. At centers, we as therapists can do that. And also, giving them the problem solving skills and allowing them to take certain decisions and validating them. So all these will definitely empower them to share their experiences, their stories with others, and how their journey has been, what has helped them, what has not. So through this way, I think they can do a lot. They can even build empathetic attitude. They themselves can raise awareness and promote the understanding of how the journey goes with individuals having developmental disabilities. And this is all what we have been discussing till now. So as I said, I'll just summarize it. This all will help them, to become advocates for themselves and others. So interact with them, give them opportunities, make sure that we educate them about their rights and abilities and issues, that affects their overall, the way they live their lives. We have to stay informed about the disability rights laws, their accessibility, the regulations and resources that are available to support their needs and make them also available. Just as Rucha ma'am gave example of, all boards, be it SSC board, CBSC board, or any other boards, they give wonderful concessions to children having developmental disabilities. So the teachers, the school, the parents, they all have to be aware of what these concessions are. And even without using them, use those concessions as their right to wherever they are needed and how the child can progress. So, just we have to widen our horizons. We have to accept them, that their needs are different, and give them all possible help, spread awareness about how this help can be given and what is the importance, because as we have been saying that sometimes there is strong denial from the parents only that no, my child will cope up later. Even I was like that, even his father was like that. So there is either strong denial or they go in the defensive mode and they don't accept that condition. So accepting it, acknowledging it, and then giving all the required help which is need based, that way also we can empower the individuals themselves to be their own advocates. So I think this is the conclusion of all the discussion I think we have been doing so far.
Yes, ma'am. Thank you for the response and concluding it very awesomely, I would say. Uh, Thank you for each and everyone over here as we have come to the end of this segment. Uh, I know developmental disability is it's a kind of a topic where the discussion is endless. The opportunities are endless, the discoveries are endless. So, like I hope like this discussion that we had right now had opened a lot more answers and a lot more windows, doors, even knocked to some closed doors, which might have been observed. So thank you to all. I would like to share my vote of thanks at this moment. So thank you for this opportunity. My deepest gratitude is to Dr. Girija Mahale, you and Dr. Rahul Bagale, Deputy Chief, to give me this opportunity to be the host of this, to give us all the platform to address this awareness in a rightful way. I would like to express my gratitude to all the panelists over here for uh, sharing their awareness, their wisdom towards us, and being with us on board and uh, giving us this precious time from their busy schedule. So, thank you, everyone over here. As this month is to leave a mark uh, on people, and we have all witnessed that. I can assure that the audience would take a piece of the wisdom and spread along with them wherever they go from here on. I would like to thank the audience for staying with us for so long and being so patient with us. Lastly, but not the least, the thanks is also to be addressed to Elisa Morris, Sangeeta Rishi Pathak ma'am. Thank you, as and the IT team for being a constant support to make this webinar a huge success. So with this, we end this webinar. Thank you all, and have a
Could you play the video that I had sent? Is it possible?
uh,
I had sent it to Sangeeta ma'am actually. Anyways, it's okay.
okay. Just let me check 1 second.
Yeah, I had sent it to the Sangeeta ma'am. So
Yes.
so it's
So I
just
think Sreshna is the host. She can play it. I think I have shared with her.
just to show. I mean, despite of so many challenges, the kind of potential that everyone has. It's just if it's
Sure,
possible.
sure.
Otherwise,
Yes, ma'am. Yes, ma'am. Just a second.
While she's checking, I have to leave now. Uh, Thank you so much for having me as a part of the panel. And
Thank you,
please
ma'am.
do keep in touch. Thank you very much. And congratulations to everybody who's participated today. Thank you and bye bye.
Thank you, ma'am. Have a great day.
You all too.
Thank you, Anita ma'am. It was wonderful to have you here.
Thank you. Thank you so
I was
much, Dr.
listening to the panel discussion all throughout, and it was really, really insightful and just shows the wonderful work you all have been doing, and really, hats off to the dedication you all have put in to make this world a better place for everyone around. So
Thank you. Thank you
definitely,
so
we
much.
would like to collaborate and take this work forward through our
Absolutely.
organization as well.
Thank you. It always works better when we all collaborate, when we all work together. So looking forward. Thank you. Bye.
Thank you.
Hello, everyone. Even I would like to take your leave as I'll be leaving shortly. And thank you so much, everybody, for providing me this opportunity and be a part of your team. And I will look forward to further such conversation of this. Thank you so much, ma'am.
Thank you. Thank you, Rucha. It was lovely to hear you and looking forward to more ongoing and sustained collaboration.
We'll have such a collaboration. Thank you.
Oh.
Shrestha, are you able to play the video?
Ma'am, there is some
Any assistance?
It's okay if it's not. That's what I thought.
No. We'll definitely play.
Yes, ma'am.
Elisa, if you can connect with some IT person to help Shrestha.
Yeah, just a second.
Or Sangeeta, you can share it with Elisa, maybe if she's able to play it.
Yes, ma'am. I have shared with Elisa and Shrestha. So, and they being the host, I think Shrestha can play it, I think.
Ma'am, is there any issue? If may I help?
Yes, I will gladly play a video. So Shrestha is struggling with it. Can you guide her?
Yeah, ma'am. There it's similar to
Screen share.
screen share. Yeah, just tick the share with the audio option. At the bottom of screen, there is a two ticks you have to do.
After we share it?
Yeah.
No, not after sharing. When you share the screen, you will get an option of tick over there.
Share with audio.
Share with audio.
Is my screen being shared?
Shrestha?
Yes, ma'am. Start.
The audio is not, but anyway, the audio is not important. So these are just different activities that are being done by them.
Lovely. Awesome.
Yeah, so I think it was very small on the screen. I think maybe it took us my mobile. But anyways, just to give an idea of there, I mean, n number of possibilities that can be given, can be explored actually.
Absolutely. Indeed. And that really sums the program very well. Our theme for today was World of Opportunities, and we've just got a glimpse into the possibilities and different opportunities that these children can be exposed to, and that we as citizens definitely need to offer them these opportunities. And each one of us needs to take on that responsibility to keep ourselves aware and sensitize ourselves to people with different needs. And definitely, we can thereby make this place a better place for everyone. So, with this concluding sentence, I would like to thank Sandra, Dr. Mitali, Dr. Rucha, Dr. Anita, and our very own Sangeeta uh, for this wonderful panel discussion, and Shrestha for allowing every member and giving them full justice with time. Even though I know that we did extend much beyond our stipulated time of 1 p.m., but I think it was worth it because I think such opportunities don't come by very often. And therefore, it doesn't matter even if we went a little beyond time. So I once again thank you all on behalf of the Center for
Thank you so much for having us here. Thanks a lot.
Arey, Mitali, you're the part of our family.
Thank you so much. It was a pleasure.
And
It was
Sandra,
very
I've
nice,
heard
very
about all your good
informative
work.
to listen to everybody's views. Really nice. Everybody
Yeah,
expressed so
absolutely.
well. And I'm really glad that everyone, I mean, not just parents, but even like they're all focusing on the quality of life, and that is really important. So that's the most important thing that can happen.
Yes,
Absolutely.
thank you so much for the opportunity. I think it was a wonderful topic to be taken for this Disability Awareness Month, and also I think we had such stimulating topics that were covered, especially like Mitali ma'am just said, quality of life, right? So I think it was a beautiful webinar and a wonderful conversation. So thank you so much.
Pleasure is entirely ours, and I'm sure that our Symbiosis family has benefited a lot today from this session. And of course, this session will be available for all viewers on YouTube. It's being recorded. So for any people who missed out today's session, this session will now be visible on YouTube. Thank you so much once again. Take care. Bye-bye.
Bye.
Requesting everyone to leave the meeting. Thank you so much for joining us.